Hi everyone! Today is Monday, October 25th, and it is the second day of National Massage Therapy Awareness Week. So, guess what I'm talking about today? All right, you all are so good. But before I even dive into this, a quick disclaimer. I am not a trained clinical massage therapist, so what I share is my basic knowledge and personal experience in performing certain methods on my own child with hydranencephaly, as well as others with medical complexities who I was given permission to massage in specific circumstances. Most people aren't at risk undergoing conventional massage, but it's certainly not recommended when other complaints exist. Things like an open or healing wound, a bleeding disorder, deep vein thrombosis, any fractures or risk of fractures, or just really any wellness concerns. There are also certain implications for massage on very young infants, which I'll share about that shortly. Just know that before settling on therapeutic massage, you should have a conversation about the risks and benefits with both your primary care manager and therapy team. Not only will this prevent injury, but also maximize the positive outcomes. So hydranencephaly presents a wide array of symptoms, making a comprehensive management the most beneficial, and that includes several forms of intervention. Massage therapy specifically serves as a complementary treatment to reinforce the benefits of both physical and occupational therapies that your little one should be receiving already. First, let's talk the benefits. They go far beyond the physical structures and go towards supporting a healthy mind, a healthy body, healthy soul. Call me crazy, but massage definitely contributes to a balanced state of mind and enhanced focus. Yes, even for those individuals living with hydranencephaly. It helps to reduce anxiety, and so it decreases those hormones associated with high anxiety that cause a lot of other problems with cortisol and all of those things. And then that in turn also decreases your heart rate, your blood pressure, just all of the things that put your mind in peace and ready to focus and be attentive. For the body, everyone associates the benefits of massage with the musculoskeletal system, but that's not nearly all of the bodily benefits. Depending upon the massage techniques used, they can enhance circulatory and lymphatic functions, allowing for better blood flow and release of toxins. It can also support respiratory health, and it definitely improves range of motion and decreases spasticity and rigidity. And because it decreases those things, it can support healthy, strong posture. And of course, there are targeted variations to pinpoint particular muscle groups. So it just depends on what challenges your child is having individually. And for the soul, massage promotes and reinforces relaxation while also encouraging healing and balance of the whole soul, in and out. So maybe you've heard of massage but aren't really sure what massage therapy is. So it's defined as the targeted manipulation of soft body tissues. It's the use of manual stimulation to apply pressure or friction and move muscles and tissue to benefit these areas. Things like your muscles, your tendons, your joints, your ligaments, your organs, lymphatic system, connective tissue, circulatory system, your whole body benefits from massage. Therapists are trained in the areas to apply pressure over the skin to achieve the desired results. They use their hands, they use their fingers, elbows, forearms, knees, and even mechanical aids. For those with hydranencephaly or other musculoskeletal concerns, they are most likely to use methods that use pressure, friction, holding, joint manipulation, rocking, stretching, kneading, those kinds of things. And other techniques for benefit as well, depending upon, again, the unique needs of your child. They'll sometimes also use special equipment to reinforce results and to also add to the positive physical and psychological contributions of massage therapy. Things like ice packs, cold packs, manual massage tools, oils, lotions, massage tables and chairs, self-massage tools, thermal wraps, heated and cooled stones. Those feel amazing if you've never tried a massage with those. Foam rollers, all sorts of stuff. So as a quick recap, some massage therapy benefits for those with hydranencephaly are reduced muscle tension and stiffness, Very, very, very increased range of motion, relief of muscle spasms, reduce stress and tension, added flexibility. It also stimulates circulation, can help manage pain, supports overall health and wellness, even reduces swelling and improves posture. So in practice, massage therapists may use multiple techniques to achieve the desired results. Multiple techniques, multiple assistance items, that kind of thing. So deep tissue procedures are most beneficial for chronic muscle problems associated with hydranencephaly or other musculoskeletal issues that result in a diagnosis of like cerebral palsy, we'll say. So in contrast to various forms of relaxation massage, deep tissue therapy uses slow, deliberate strokes to release chronic tension from the muscles, joints, and tendons. So by applying this pressure or friction against the grain of the muscle and then reaching those deeper layers of tissue, massage therapists effectively reduce stiffness and spasticity experienced by those with hydranencephaly. So the positive effects of therapeutic massage are not limited to the surface musculature, like I said before. On the contrary, it yields positive gains across the body's organs and major systems. Massage therapy can provide benefits to all of the systems, and that includes circulatory, digestive, lymphatic, nervous, respiratory, skeletal, endocrine. What else is there? Um, so typically massage first let's chat relaxation massage. So it happens in places like sports clubs, health facilities, spas, resorts, those kinds of places. Sometimes even in malls or chain retailers. That's the basic massage. Sometimes it's called Swedish massage, totally different than what we're talking about with medical massage. And then the benefits that we're talking about. That type, the medical massage or therapeutic or clinical massage, it's usually done in a medical setting. It's done in places like a chiropractor's office with a physical therapist. Some hospice workers are trained in massage, or really just a health clinic setting, right? But both of them are performed by licensed massage therapists who have obtained board certification, and those people are regulated by the state as far as their licensure and credentials. So people like a licensed massage therapist, you'll see LMT. LMP is a licensed massage practitioner. And then you have a CMT, a certified massage therapist. Those are the basic ones. I think there might be some other credentials as well. Keeping your expectations in check. It is a specialized practice. Relaxation massage and medical deep tissue massage do give a huge range of benefits. I'm a huge supporter and I don't get nearly enough massages, but I definitely made sure my littles got lots of massages when they were really small. But specialists are trained and licensed to ensure consistency across the field, like I was talking about through their licensure and credentials. But just as a quick reminder, they do not make medical diagnoses. They are not able to prescribe medication. They are not able to give psychological or medical recommendations. They definitely do not perform surgeries or medical procedures. They're not nutritionists. They cannot give nutrition counseling. And of course, they also don't perform cosmetic procedures. This doesn't mean that they can't say, hey, you should talk to your doctor about these things, but they definitely shouldn't be giving recommendations in those areas, and they should know better than that. So with all of that, and a friendly reminder again that I am not licensed or certified, please speak with your therapist or primary care manager before starting to get into this too deeply, though I'm going to be pretty basic here and share stuff you can find online yourself. I usually recommend starting infant massage after the umbilical cord falls off, though there really are no set guidelines, only that some experts recommend waiting between 10 days to 2 weeks before starting to use any sort of oils or lotions because the newborn skin barrier isn't developed yet, and it makes them really vulnerable to becoming dry or having some sort of reaction to foreign substances. And the umbilical cord area can actually become infected or irritated from exposure to those things too. So I just find it best to wait for that to be out of the way and healed. Also, if your baby is premature, talk to your doctor. Definitely in this case, talk to your doctor. There's a lot of factors that could come to play if your child is premature. And there's definitely no age limit to stop giving massages. For kids with any additional needs or medical complexities, I recommend you never stop, honestly. But read your child's cues to know what works best for them. If you, as a parent, make it a routine, you can make it whatever you want that is of the most benefit. I personally highly recommend the loving touch method, which I learned when my own little man Braden was wee little. He was not even a year old, probably, way back in 2009. So the International Loving Touch Foundation is one of the world's first established training programs of infant massage, having been officially incorporated in 1992, but their founder actually began teaching way back in the early 70s. It is an accredited program, so feel free to look it up if you are interested in actual training programs. Diane Moore is who I learned the method from. She is the founder and director, and she has a slew of books, online lectures, audiovisual materials, and whatnot. And I actually think, well, I heard through the grapevine that she just launched an online training program as well. So I'm going to be checking that out as soon as I can. So while I talked about starting early, it's also important to know that it's never too late to begin massage. Regardless of when you adopt these methods into yours and your child's routine, massage brings immediate and lasting results. The loving touch method believes that infant massage is most important as a bonding activity between parents and their children that also includes things like vocalization, eye contact, and other positive behavior reinforcements. I learned lots of songs to go with the methods and whatnot. The videos that I am sharing with you do not include those things, but they will be helpful regardless. So it is a social, emotional, cognitive support method to promote, all types of healthy development for children. Yeah, all of this to say, I've considered becoming certified to teach infant massage, but have not yet. But I'm going to share a video that shows some basic techniques that I have used frequently and saw huge benefit from. This is the basic stuff and a lot of what I did with Braden from the moment I learned about these methods until the end of his life with me. I would demonstrate the full routine, which is what my biggest desire was, but I don't think my teenagers would approve, and I don't know anyone with an infant to borrow. So I'm going to show this video really quick. Bear with me while I share my screen. And of course I can't find it, so give me just a second. Oh, okay. Make sure I share my sound. All right, let me pull up the correct video and enlarge that for you.
Press, very similar to the legs.
Start at the beginning.
Corwin Southern, pediatric occupational therapist and certified infant massage instructor at URMAC. And today I'm going to show you some simple massage strokes to get started with touching your baby. It's recommended to start first with the legs, and so I'm starting here, going from his thigh to his ankle. This is called Indian milking. You can do anywhere between 5 to 10 strokes. There's no set required number, whatever you feel like is good and which is good for baby. This is called turn and caress. It looks like an Indian burn, but you're just moving, gliding your hands and fingers back and forth. Next is called fanning. You're going to go from the heel right up to the toes, just like you're trying to get the wrinkles out of the bottom of his feet. This is called rolling each toe, just like you're rolling a small pea. And then you're going to go into Swedish milking. Swedish milking is going from the ankle right back to his thigh. So it's a moderate pressure. And then you're done with his leg. Now obviously we'd do the other leg at the same time. We're going to move up to his arm now. So I reposition them. You can do this while you're sitting on the floor or on the bed. You start off with the same stroke, just gently straighten his arm out. This is the Indian milking. Now I'm going to turn and caress. Very similar to the legs. In the palm of the hand. Just moving my finger. There's a lot of sensory receptors right in the palm there. Rolling each finger. And I'm trying not to force his hand open. Just gently opening his fingers, gently straightening his arm. Now I'm going from wrist to his shoulder. Just like that. Okay, then obviously I'd go to his other arm, but I'm going to move to his tummy. Start with paddling. I make sure I'm below the rib cage. Just a downward stroke. I wouldn't do this right after feeding, especially for his tummy. Just gentle strokes. This is called foaling. This is called hands of the clock. You're going clockwise, right on his tummy. You can go below his belly button, right up around. This is called the I love you stroke. We're starting on his left side. Down, that's the I, and upside down L, and then an upside down U. So I love you. And this helps with digestion. You got descending colon, transverse colon, ascending colon. So you go clockwise. Next is his chest. You're going to start right in the middle and go right out to his shoulders. That's called the hello stroke. This is called the heart of love. I'm drawing a little heart right on his chest. There's a lot of research on infant massage, and it shows that it helps babies developmentally, increase bonding between parents and baby. I'm going to roll him on his tummy because we're going to do his back next. Okay, we're just starting with his neck and going straight down. Just straight down like that. This is called streaming, kind of going back and forth. This is called a Petrissage. I'm using the pads of my fingers. Just massaging his back. And then I'm doing this long stroke again. This is called Effleurage, which is long strokes. And then with my fingers kind of rigid, just on his back, this is called combing. Combing his back. So babies that have had infant massage have been shown to score better on motor tests at 8 months of age. You're helping with a lot of the circulation, moving the blood flow to the extremities and back too. The tactile touch is shown to help with body awareness, and most babies really like it. If you would like more information about infant massage, you can contact us at ERMAC, and you can sign up for one of our classes.
So that is that. Let me stop sharing really quick. There we go. So the only difference I want to note from that video is that when I was taught to start at the left leg and work around the body in a clockwork fashion, just like he kind of did on the abdominal exercises. So we did left leg, left arm, head, chest, right arm, right leg, and go right around. As he got older, when he was really small and I first learned, it was after his shunt surgery, but his head was still pretty large and he was still really uncomfortable on his belly, but I did use a boppy to flip him over. And I did his back first and then I did his front because he was really uncomfortable on his back. So I tried to start with that so then he was able to relax in the back exercises. There are a lot of methods to help with gas and constipation, things to get things moving, but that I love you method is something that I did very, very, very frequently with Braden. It helped to alleviate a lot of challenges for him. But all right, that's all I have for you this week. I will see you again next week with another video. Have a great one.